Thanks so much for staying with us. This is Ultra Life Today. I am Josh Bellew. My dear friend Adam Payne is down at the other end, and Mary Jane Fry, PharmD, our friend from Medic Pharmacy here in Oklahoma City, sees a lot of people in private consultation. She's taken her years of experience and her continuing education to be able to do various types of tests that are not the types of tests that you're often going to find at a conventional MD's office. And these tests, most of them are actually not paid for by insurance as well. And we're going to talk a little bit about that and talk about the value of that. And I had something, I hear these words a lot, Mary Jane Fry. Maybe it's a buzzword, and I know it kind of it rides the crest and then goes back down, but adrenal fatigue. Can you tell us what adrenal fatigue is, what the symptoms are of adrenal fatigue, and then how you are able to test for that, and then maybe some of the simple practical things that people could do, even if they're not immediately buying up, 10 different supplements and all that?
So adrenal fatigue is something that traditional doctors don't always recognize. You either have Cushing's or Addison's disease, which are the extremes of your cortisol. Your adrenal gland is our master gland of energy. And so when somebody's been in chronic stress, then the cortisol level kind of flattens off. So when you're not in a stressor, your cortisol wakes you up in the morning. So you have a good amount of cortisol that wakes you up. And then throughout the day, it goes down. So by the time you're ready to go to bed, your cortisol is at its lowest level so that you can go to sleep.
Wow, interesting.
So anything that throws that cortisol out of whack, it can be an acute stressor, it can be a chronic stressor, moms taking care of sick kids. If they do that for too long of a time frame, then they just get worn out. Or this whole COVID, you're sick, you're tired, your adrenals can play a part into that.
Are there specific foods or beverages that affect that in our body?
Absolutely. I mean, carbs are going to, sugars, caffeine, they're all going to affect our adrenals and how we respond. And it has to do, the adrenals also interplay with blood sugar. If you have a high cortisol level, a high stress level, then your blood sugar goes up. And if you then dysregulate and can't modulate your blood sugar as well, then you crash. And so there's all these different systems that are so interconnected.
And so when you mention that, it makes me think also, is there a connection with people as it relates to their metabolism and their weight when it comes to cortisol?
When women come in and they've had a major stressor and they have weight around the middle, and sometimes that's menopause, they've stopped sleeping and they get the weight around the middle, then there's typically going to be a cortisol effect. There can be an insulin resistance that develops because of that cortisol effect. So yes, and one thing weaving back to the hormones with it all is that people will come in and they say they have hot flashes or night sweats, specifically night sweats. And I'll say it's not just estrogen being low. You have high estrogen, you have low estrogen, you have liver issues, you have blood sugar issues, you have dehydration issues, you have adrenal stress issues. All of these things can affect you for hot flashes or night sweats or waking up in the middle of the night. And so that's something that I want to dispel, is that it's always going to be an estrogen, because the gynecologist will a lot of times throw them on an estrogen or put them on an estrogen, and then they come in and say, I was better for a while and then it got worse again. And they immediately say, well, then let's double it or let's take more. When you have to look at what other symptoms are going on to know whether they've gotten too much or too little, or if something else is going on.
So that's fascinating.
Yeah. When you do a test panel for adrenal fatigue, what's the cost of that test? And is it just one test, or do you need to do multiple tests? And then what are some of the solutions that you offer?
So if somebody has adrenal fatigue symptoms, or if they're waking up super early in the morning or they can't go to bed at night, I'll usually do a 4-point cortisol test. If they need hormones also, then I will add the whole hormone profile with it.
Okay.
So they can be both. And so if they do 4 cortisols, which would be morning, before lunch, before dinner, and before bedtime, and then we add an estrogen, a testosterone, a progesterone, and DHEA, which is another adrenal hormone that goes down over time. If we add all of those together, it's 210.
Okay, wow.
So, and that's a 4-point cortisol saliva test.
That could be a life-changing event for someone.
It can be life-changing,
And
yes.
so I'm curious, though, when you find out those things, I know we've talked a little bit about dietary considerations, but are there specific supplements that kind of are the flagship supplements that typically you recommend to someone that's got adrenal fatigue?
Everybody's doing something different in their bodies. Their reason for their adrenal fatigue, how long it's been, if it's a mixed adrenal, early or late, if they're flatlining. So there's not everything is one.
Okay.
Now, one thing that I look at a lot, especially if it's severe, is I give them one of them, well, the combination, it's magnesium and vitamin C and pantothenic acid, which is one of our B complexes.
Oh, interesting.
And those 3 do a really good job of helping support the adrenals from the cofactor, so the support staff per se.
And those are things I've known about since I was like 15 years old, and my dad read Adele Davis books. That's just
I'm
crazy.
curious, does SAMe play a role in this whole adrenal?
SAMe is tricky. SAMe is part of the neurotransmitters. It's part of the methylation processes. But you really need more tools to just then
Before you
throw
dial that in.
somebody. Yeah, sometimes people throw people on SAMe, and that worries me because they don't know
Everything
all the
else.
pieces, and
Yeah,
you
yeah.
don't put everybody on SAMe.
Our mission is to take nature's most beloved botanicals and enhance them with our liquid protein scaffold technology. This helps it reach your cells faster and better. With exponentially enhanced bioavailability, you'll feel better every day. Ultra Botanica, the feel-good curcumin.
Yeah, and I think, Mary Jane, you just mentioned something that is so vital. You know, for those of us that are health food store freaks, and there's even a good friend of ours that just walked in the room named Kyle Drew that happens to be one that darkens the door of every health food store in every town. but we creep up and down the aisles, and like I think Kyle and I kind of buy into the market speak sometimes. It's just like, I've just got to try this. But you mentioned something really important, and it goes back to this process you have of diagnosing, because everybody shouldn't just walk around and go, Sammy, I'm not feeling quite right today, or 5-HTP, I'm just depressed and I'm just going to boost my serotonin levels. You're doing something that allows people to actually dial in on knowing what exactly it is that they need and then how much to take, right?
Well, right. And I don't want people spending money on things that isn't honed into that specific
We
spot.
love you.
So I have this woman right now who, whenever the health food store, the grocery store has a sale, she wants to buy 3 of something. And I'm like, stop buying 3. And she's like, but it's on sale. I said, and it's going out of date.
Yeah.
And it's not the product for you.
And you may not need to be on it
Right.
for
And you
a
don't-
lengthy
yes.
period of time.
It actually might be
So-
detrimental.
Right.
Yeah, and that's what I
so there's a
wanted to
lot
point
of
out.
protocols where they're selling 3 because they want to keep you on something for 3 months, but it's not always right at the beginning, you're not going to know whether that's the right product for you. So
Right. We need to do testing. We need to get a good clinical vignette or a medical history of what's going on with the patient. And then it all needs to come together synergistically into your brain, Mary Jane.
not my brain.
But we need it. It needs to come through somebody's filter to really get a good clinical picture where we synergize the genetic, the metabolic, the medical history, and can start figuring out what is the right balance for that particular person.
And I want to say one more thing. You said diagnose. As pharmacists, we're
You
not
don't
allowed to diagnose.
That's correct.
So I don't diagnose anybody with anything. I can say you're having these symptoms.
You use diagnostic
doctor.
tests, right?
We do some testing.
Okay.
There's screening tests.
Okay. I wanted to know the right.
tests.
Yeah, I wanted to know the right verbiage
And
there.
there's
so
something called
I
a
don't step
soap
across
note
that
that
line
you guys
anymore.
do. Soap notes.
Well, the medical profession always started with a SOAP note: subjective, objective, assessment, and plan.
Right.
I kind of throw it all in together sometimes. I'm not probably clinically right. I don't have to chart for insurance.
Right.
And so I'm not as good on the SOAP note, but I actually remembered what each letter meant. So I think that's pretty good.
There will be
You're
a
doing-
test at the end of the podcast, and you just passed.
I passed. So,
Yeah.
but yes, we have to look at the big picture. And that's, like I said, that's where I like the genetics, is we're looking at the forefront.
So I want to end with one thought. We interviewed a gal named Dr. Jay Dunn.
Well, that's where I wanted to go. So please
Right,
go
yeah.
there. 'Cause I have a
She
question
developed
about
a panel based upon looking at not just the SNPs that were available, but looking at metabolic pathways in the SNPs. And she pulled in 650,000 SNPs, which is a good number. It's not the most you can put together.
No,
And
that's not accurate.
600
650,000 might be how many we have, but the number that are clinically and scientifically
And that's where I wanted to
utilized,
go, Mary
3x4 talks Darwin.
Right.
They call their testing the Darwin. It has to pass Darwin. So it has to be scientifically sound and clinically significant.
Right.
So 650,000 is nowhere, nobody's there yet.
Right. Okay.
With the SNPs and the genes and the genome.
Well, she purports to have a unique overlay that she has researched for each one of these SNPs and how they relate together for metabolic pathways. And it was a fascinating discussion with her.
Yeah.
And we're actually going to do another interview with her. And we've sent in my gene profile, just
Okay.
like we did with you and me in the 3x4. And we're going to see what she comes back with for clinically relevant ideas on my genome.
through the metabolic pathways.
Right,
With
and
the metabolic
with
pathways.
with her screening. So I'm really looking forward to that.
That'll be interesting.
Yes.
And Mary Jane, with a couple of minutes left, I'm going to put you on the spot a little bit, I think, because you mentioned something as it related to the 3x4, and you mentioned the word clinically relevant as it related to that. What does that actually mean to people? I know that when you and I began to discuss this the other day, you were like, the reason I like to rely on 3x4 is because there's good clinical evidence that what they are doing is
The scientific sound
is
and
appropriate.
then right. So the example that the head woman at 3x4, and her name is Yael Jaffe, Yael Jaffe, Joffe, I think, or
Okay.
Jeff. And what she says that is the perfect example is that lactose is scientifically sound. If you have a lactose intolerance, the lactose gene, that's scientifically sound. But when they put it to the clinical test, it wasn't clinically relevant.
Wow,
There were
that's
people
interesting.
that scientifically they have the lactose gene and they have no problem with their taking in lactose, and others do. And so she said, ours does not have that gene. And anybody that has that gene in their profile is not looking at clinical soundness.
Okay.
And so that's why I trust the tests I'm
Yeah,
utilizing,
that's great.
because there's a lot of people who fall on that. Now, my mother was lactose intolerant her whole life. The entire family ate lactose our entire life until I did a challenge and I found out that I'm really lactose intolerant. And so I clinically know
Right,
that I have
right.
lactose issues. But I haven't ever been tested for it, and I don't care if they tell me I am or I ain't, because I'm
Got you. Hey,
am or I aren't, because I know that that's an issue. And maybe it's the inflammation picture that goes along with it. Maybe it's the histamine.
It could also be other
things.
cofactors that have to do with receptors and and all that stuff.
And there's not enough together at the same point to have that specific gene in a pathway.
Interesting.
Okay.
Well, I mean, Dr. Dunn's done some interesting things, and I'm really going to be fascinated.
But I want to hear her talking.
Yes.
I want to see her
All right.
research.
You've been listening to Mary Jane Fry, PharmD, Medic Pharmacy, Oklahoma City. You can reach her by phone at 405-755-3921, 405-755-3921. You can go to their website, medicokc.com, medicokc.com, or if you know how to spell, you can go to Medic Pharmacy at sbcglobal.net. I am Josh Bellew. This is Ultralife Today. Adam Payne, my dear friend and the CEO of Ultra Botanica. We're saying goodbye for now, but please tell your friends about us. We love the fact that you're sharing and that we're growing. We're now in the Boston market, so welcome, Boston. And we'll see everyone next week.
Have a great week, guys. Bye.